this time we are going to teach you how to prepare medications for skin testing. So after diluting the powdered antibiotic, so you now prepare your tuberculin syringe or 1 cc syringe, and then your 5 cc or 10 cc syringe. So this is your diluent, this is sterile water for injection, and sometimes we can use plain NSS. At this time we are going to use sterile water for injection. So in skin testing, you only get 0.9 ml of diluent. So you start first with your diluents, the sterile water for injection. So open the syringe, keep the syringe needle sterile. Then since this needle, this gauge 26 needle, this is smaller, and this you are going to use this needle for skin testing, so it has to be sharp. So you have to replace this needle with another needle to withdraw medication inside the vial. So you get another needle, this one. Maintain the sterility of the needle. Do not touch this area or the hub area of the needle. So just hold this area, then change needle. Keep this needle sterile, this hub area sterile. So you can put this inside the wrapper of the syringe because this portion here is still sterile. So that one. Then now you can withdraw medication. So you open the cover of the needle. So again, since you are going to get 0.9 ml of distilled water, you also move this plunger down, and it should be 0.9 ml as you can see on this level. So you get the diluents now. Then you hold the plunger like this. Make sure that your thumb and your index finger is supporting the plunger like this. Then inject the needle. At first with a slant position, but later on like this. Inject, and then this is the plunger now. You put the plunger, you move the plunger down, then invert. Do like this, still holding the plunger, and get 0.9 ml of distilled water. So there are bubbles, so you can tap with your fingers, or you can move this plunger up and down to get rid of the air. So remove, then you expel the air inside the syringe by doing like this or by moving the plunger. So it's 0.9 and there's no air on it. So then after that you get 0.1 ml of reconstituted antibiotic. So still holding the plunger like this, you inject the needle slantly, and then like this, still holding plunger. Do not move the plunger down because you are introducing the medication inside the vial. So just hold the plunger and invert and get 0.1 ml of antibiotic. So since it's already 0.9, so you just move the plunger down. Okay. So 0.1. A total of 1 ml. Still, check the syringe if there are presence of air. Then adjust the plunger. Then cover the needle using your scooping technique, and then now that you already withdrawn distilled water and medication, you can now change your needle, with the gauge 26 needle, to get ready with your skin testing. So you are now ready in doing skin testing for the patient. So you prepare your alcohol swab, and then your dry cotton balls, then you go to the patients. Good morning, ma'am. How are you today?
Good morning. I'm okay.
My name is Marites Sarocan. I am your nurse, and the doctor has an order to give you antibiotics through intramuscular. So, may I know your name and date of birth?
Marby Pabora, August 8, 2008.
Okay. So, your antibiotic is ampicillin. So, we are going to check if you are not allergic to this antibiotic. So, we're gonna introduce a very small amount of antibiotic on your skin to check if you're not allergic to it. So, I'm going to inject small amount of antibiotic, then I'm going to come back and check if you're not allergic to it or there is no presence of rashes or itchiness. That's it. Is it okay?
Painful?
Yeah, it's a little bit painful, but I'll just do it very quickly. Would it be all right? Okay. Okay. So,
select injection site on forearm if no other site is required by agency policy or doctor's order. Use alternative site if forearm cannot be used. Position client with forearm facing up. Cleanse site with alcohol using a circular motion starting from the center and working outward. Allow alcohol to dry. Remove needle cap. Place non-dominant thumb about 1 inch below insertion site and pull skin down. Talk to client and warm on impending needle stick.
ma'am, I'm going to inject the medication, ha?
With bevel up and using dominant hand, insert needle just below the skin at 10 to 15 degree angle. Once entry into skin surface is made, advance needle another 1/8 inch. Inject drug slowly and smoothly while observing for blebs. This is a raised welt to form arm. The bleb should be present. Remove at same angle that was inserted. Gently remove blood, if any, by dabbing with second alcohol swab. Observe skin for redness or swelling. If this is an allergic test, observe for systematic reaction like respiratory difficulty, sweating, faintness, decreased blood pressure, nausea, vomiting, and cyanosis. Reassess client and injection site after 5 minutes, after 15 minutes, then periodically while client remains in clinic.
After creating a bleb, you have to put a circle. You use your black pen or blue pen. So, red ball pen is not allowed. So, you time. So, if the time of injecting the medication is 10:30, so you will be back at 11. In some hospital, they will put the date the skin testing will due. So, they will write due at 11 a.m. But in some private hospitals, they just put the due date on the chart.